The human body operates as a self-healing machine. To coordinate every breath, movement, and immune response, that machine relies on a master control center, the nervous system. But this network of nerves doesn't operate in a void. It is housed entirely within a mechanical structure, the spine. If that physical housing develops a distortion, the resulting pressure can cause systemic errors throughout the entire body. The concept linking this rigid skeletal structure to biological function traces back to 1895 to Daniel David Palmer, a self-educated scientist in Iowa. Palmer was waiting for a client when his janitor, Harvey Lillard, walked by. Lillard had been deaf for 17 years. Palmer noticed a small bump on the back of Lillard's neck and applied firm pressure to push it in. Lillard felt a sharp snap in his back and suddenly declared that he could hear again. This interaction led Palmer to a radical deduction. He proposed that even minor mechanical misalignments of the vertebrae, which he termed subluxations, directly disrupt neurological function. Correcting these physical issues by hand could therefore restore the body's health. Proving that structural anomalies were causing invisible nerve issues was a massive challenge, but Palmer's theory happened to coincide perfectly with a medical breakthrough. This archival photograph shows an early X-ray apparatus positioned over a patient. Discovered in 1895, the exact same year chiropractic was founded, this technology gave practitioners their first ability to look straight through the skin. Early chiropractors relied on manual palpation, feeling the symmetry of the spine with trained hands. Now they could finally pair those physical observations with hard radiological evidence. Looking at this anatomical diagram, we can see the tight quarters involved. The bony structures of the vertebral column sit in extreme proximity to the delicate nerve roots exiting the spinal cord. Confirming the exact placement of the skeletal structure became the foundational step. By identifying the position of the bone, doctors could begin treating the neurological dysfunctions associated with it. To explain exactly how a physical adjustment restored health, early practitioners relied on what they called the bone out-of-place theory. If a vertebra slid out of alignment, it blocked nerve signals traveling to the brain. Doctors used a garden hose analogy. Step on a hose, the water stops. The solution is mechanical. Manually push the vertebra back, and the nerve impulses flow freely again. It was a simplified model of biomechanics. Yet, by physically moving these bones back into place, patients frequently reported significant healing effects. As the discipline matured into the mid-20th century, a Belgian chiropractor named Henri Gillet realized looking at the spine as a stack of static blocks wasn't giving the whole picture. Gillet developed the intervertebral motion theory, observing that abnormal nerve signaling wasn't always caused by a bone physically pushed out of line. The true culprit was often fixation, a loss of normal spinal joint movement. A specific segment locks up and fails to move smoothly with the rest of the skeletal system, creating local irritation. This shifted the entire objective of a physical intervention. Practitioners moved away from simply focusing on position and instead worked to restore dynamic mobility to joints that had frozen in place. As seen in this photograph, modern treatments adapted. Chiropractors combined manual thrusts with mechanically assisted drop tables to introduce fluid motion directly into locked joints. Shifting the theoretical focus from static position to dynamic motion expanded the physical tools available to practitioners, increasing the scope and effectiveness of chiropractic care. Intervening physically on a complex biological machine carries inherent risks. Pushing on the spine means working against structural limits that must be respected. Modern chiropractic medicine recognizes absolute contraindications, situations where spinal manipulative therapy is structurally dangerous and must never be performed. This clinical graphic outlines those strict boundaries. If a patient presents with malignancies, bone infections, acute ankylosing spondylitis, or fractures, manual adjustment is out of the question. Physical manipulation has physical consequences. Side effects can include temporary tiredness and discomfort. There are also rare reports of severe complications, such as stroke or cauda equina syndrome, where the nerve bundles in the lower spinal canal become pinched. Acknowledging these structural limitations and risks transforms the practice into a codified, responsible medical discipline. In its modern form, chiropractic operates as a multimodal discipline. By utilizing joint mobilization, soft tissue therapies, and guided exercise, it serves as a non-pharmaceutical approach of first resort. The clinical focus remains on the mechanical framework. Practitioners work to identify and correct the underlying structural cause of a dysfunction. This approach returns to a founding philosophy that the body possesses an inner wisdom and an innate potential to heal itself. By correcting the physical structure of the body, we optimize the master control system. This empowers the body's innate ability to restore and maintain its own health.